Student nurse stress in the clinical setting is an important and relevant practice issue that nurse educators must address. It is part of our role as nurse educators to ensure that students are learning and practicing nursing in a context that supports their health and well-being. Based on a review and appraisal of the current nursing literature, I found that there are 4 types of interventions studied for effectiveness in reducing student nurse stress in the clinical setting. In this video, I will discuss recommendations around these 4 interventions for clinical faculty to consider. The first intervention that I will discuss is peer mentoring. When implementing this intervention, I recommend that clinical faculty use mentors that are in a higher level of the nursing program than the mentees. This is to avoid creating a power differential amongst students and to help students feel more comfortable asking for help from their peers. Further, I recommend that clinical faculty use peer mentoring for only 1 or 2 days, as the literature indicates that students perceive there to be little added value to additional days of mentorship. Another recommendation for clinical faculty to consider is to orientate students to the mentee and mentor roles and to delineate specific ways to support students in this experience and to address any issues that may arise. Lastly, I recommend that students meet prior to the mentoring experience so that students have the opportunity to gain a rapport with each other. The second intervention that I will discuss is simulated clinical experiences. I recommend that clinical faculty develop comprehensive simulated experiences with the help of students so as to address specific clinical stressors. These simulated experiences should be linked to clinical objectives and reflect the clinical environment and patient scenarios that students will encounter in their current clinical placements. I also recommend that clinical faculty become comfortable using human patient simulators so that time is not wasted when using simulation and so that they are prepared to address any issues or questions that may arise. Lastly, I recommend that clinical faculty allow time for debriefing and reflection. Individual student debriefing can occur when mistakes are made, and guided reflection can occur to support students' critical thinking during the simulated scenarios. Clinical faculty should also provide group debriefing sessions that allow for student-led discussion regarding this experience. The third intervention is demonstrating constructive teaching behaviors. I recommend that clinical faculty reflect on their own teaching behaviors and elicit feedback from colleagues and students so that they can understand how their teaching behaviors are being perceived. After doing so, clinical faculty can then make a conscious and deliberate effort to change or modify their teaching behaviors so that they can be more intentionally constructive in their nursing education practices. I would like to point out that the invitational educational model can support clinical faculty in developing inviting or constructive teaching behaviors that demonstrate trust, care, respect, and optimism towards nursing students. I recommend that clinical faculty refer to this model when using this intervention. Lastly, I recommend that nursing programs develop workshops or seminars about constructive educational practices so as to provide clinical faculty with the opportunity to learn about and develop their own teaching behaviors. The final recommendation pertains to multimodal approaches. Multimodal approaches use a combination of different stress-reducing interventions to address the different clinical stressors experienced by students. When using a multimodal approach, I recommend that clinical faculty consider whether there is adequate or convincing evidence that supports the use of each chosen method in relation to the reduction of student nurse stress in the clinical setting. I would like to point out that there are only 3 interventions: peer mentoring, simulation, and constructive teaching behaviors for clinical faculty to draw on. Due to this, clinical faculty may consider incorporating interventions that have been found to be successful in reducing student nurse stress in the classroom setting and that may have a similar effect in the clinical setting. If you choose to do so, I recommend that you evaluate the effects and outcomes of using these classroom-based interventions to enhance knowledge in the area of in the area of introducing interventions in the clinical setting. Lastly, I recommend that clinical faculty consider the level of nursing students and the type of clinical placements that they will be commencing so that multimodal approaches can be tailored to students' learning needs so that we can better prepare students for a particular practice setting. I hope that clinical faculty consider implementing these interventions in their own educational practices so that we can promote a healthier context for students to learn in.